Hello and welcome to this short training video. I will show you how to correctly prescribe a taper dosing in the Cerner EPR system. So taper dosing is a functionality that exists within Cerner that allows you to prescribe a reducing schedule of a particular drug, and I'm going to use prednisolone, so it's steroid tapering dose, as an example in this video. So this functionality, normally you prescribe through the doctor's view and the manage M page or any of the M pages, and you use the new order entry component. However, this functionality for taper dosing doesn't exist within the new order entry component. So similar to sequence prescribing, which is another functionality which is only available through request and prescribe, you need to navigate to the request and prescribe page to access the taper dose feature. So once you get to request and prescribe, you click on add, and that would fire the order search window. And at this point, you search for the drug you wish to taper. So in this case, I'm going to use prednisolone as an example. Please try and choose a order that has an order sentence associated to it. So the one that says MIG, root oral, tablet once a day in the morning. When you click on this and press done to close this window, you will see the order added to the scratch pad. So at this point, please pay careful attention to this small green graph icon, which is when you hover over it, it says taper dosing. So if you click into that, it fires a new window. So at this point, you put the starting dose into the dose field. So this will be 40 milligrams as an example. Make sure you got the dose unit correct as milligram, route as oral, and frequency as once a day in the morning. So if you chose the correct order sentence at the start, that will pre-populate for you. Whereas if you didn't, you would have had to fill those 3 fields out manually. And in the taper details box, you can see it says reduce by. So at this point, I just want to highlight you can increase as well. So you can use this feature to do an up titration of dosing as well as doing a reducing schedule. So you want to reduce by, let's say, 5 milligrams. So you type in 5, and you can also do percentages of doses, but it's recommended to keep it to the dose unit. And you have to tell the system the interval of the reducing schedule. So how often you want to reduce it. So I'm going to say every 5 days. So we've got 40 milligrams once a day in the morning, reducing by 5 milligrams every 5 days until a final dose of 5 milligram. So if you want the patient to stop, please don't enter 0 milligrams in here, because that's not a dose that the system recognizes. So if you want the patient to stop the dose after X amount of days, you choose 5 milligram as the final dose, and make sure you select this radio button of stop final dose, and then you can tell the system after how many days you want that final dose to stop. Conversely, if you wanted the patient to stay on a maintenance dose of a drug, you can say continue until instructed to stop. And what that would do is continue that particular maintenance dose until the patient stops. So I'm going to, for demonstration purposes, I'm going to select stop final dose after 5 days. And at this point, click calculate steps. And now what that does is create individual orders for each part of the tapering schedule. And you can see that it carries the right start and stop date and the right number of doses. What that means is on the system, it places these as multiple different orders, and there is no ambiguity for a nurse as to how to administer this. So it's a really great feature to use, and it's very clear for all members of the MDT that this patient's on a reducing schedule. And even when you come to do TTOs, it can be pulled across and can be very clear. And as with any prescription, you need to answer the question of, do you want to give an additional / immediate dose now? And that is asking you, do you want to create an additional stat dose on top of the normal scheduling? For which I'm going to say no in this case. But that would depend on the time of prescribing, whether that's appropriate to tick or not. Just bear in mind, saying yes to that creates an additional stat dose on top of the normal scheduling. And it'll be good to use, say you're prescribing this once a day in the morning, and if you're prescribing it midday, or if you're prescribing it at like 10, 11 a.m., where the 8 a.m. once a day in the morning timing has passed, then it might be a good time to say yes, because you want to give that there and then. So at this point, you just press OK, and you can see you've got it correct if there's a green icon associated to it, which is part of a taper. And when you drop that down using this arrow, you can see the individual orders for that tapering schedule. Just bear in mind the tapering dose schedule feature is it's only beneficial to use if you're reducing by a set increment. So if you have variable dose tapering, this functionality doesn't work. Likewise, if you're doing a increasing regimen where you're stepping up the patient, if it's variable dose, it won't work. So just a key point that this functionality is only to be used if you're increasing or reducing at set increments of dosing. So here you can see it's at 5 milligrams. Once you're happy, just press sign and hit refresh and go to the drug chart and refresh the drug chart. And you should see that I've got prednisolone starting tomorrow morning at 40 milligrams. And then 5 days later, I've got 35 milligrams and so on and so on. And you can see that it goes all the way down to 5 milligrams for 5 days and then we'll stop. So that is how to correctly prescribe a tapering dose using the Cerner EPR system. Thank you for watching.